Hello everyone, welcome to Nursing Arena. My name is Kritika Andara and today we are going to enhance our knowledge by the questions of obstetrics and gynecology. Please don't forget to like and subscribe our channel. Let's get started. First question. In primigravida, total duration of labor is 14 hours, 20 hours, 12 hours or 18 hours. The correct answer in primigravida, total duration of labor is 14 hours. The outermost membrane that helped to form the placenta, chorion, amnion, amniotic fluid or peritoneum. The correct answer, the outermost membrane that helps to form the placenta is chorion. Chorion is a double-layered membrane formed by the trophoblast and the extra-amniotic mesoderm, which eventually will give rise to the fetal part of the placenta. Next, MTP Act was passed in 1971, 1972, 1973 or 1974. The correct answer, MTP Act was passed in 1971. MTP Act 1971. It is an important act for the termination of certain pregnancies by registered medical practitioners and for matters connected therewith or incidental thereto. It extends to the whole of the India except the Jammu and Kashmir state. Anterior fontanelle normally closes between 2 to 3 months, 3 to 6 months, 18 to 20 months or 1 to 9 months. The correct answer, anterior fontanelle normally closes between 18 to 20 months. Fontanelle allows the skull to deform during birth to ease its passage through the birth canal and for expansion of the brain after the birth. Anterior fontanelle is the largest fontanelle, which is measured about 2.1 cm, also called as bregmatic fontanelle. It is diamond in shape. After delivery, mother should be placed in dorsal position, lithotomy, left lateral position or none. The correct answer, after delivery, mother should be placed in dorsal position. Dorsal recumbent position is a position in which the patient lies on the back with lower extremities moderately flexed and rotated outwards. It helps in observing the abdomen, genitals as well as rectum. Hormone which helps in production of milk is FSH, that is follicle stimulating hormone, prolactin, LH, that is luteinizing hormone or oxytocin. The correct answer, hormone which helps production of milk is prolactin. Prolactin is produced by pituitary gland by the brain, also known as PRL or lactogenic hormone. Indication of fetal distress is decreased fetal scalp blood pH, meconium staining, late deceleration of heart rate, all of the above. The correct answer, indication of fetal distress is all of the above. Fetal distress refers to signs before and during childbirth indicating that fetus is not well. It occurs when fetus has not been receiving enough oxygen. Increased nuptial translucency observed in the 13th week of fetal ultrasound is characteristics of Turner syndrome, Klinefelter syndrome, hydrocephalus, or Down syndrome. The correct answer: increased nuptial translucency observed in the 13th week of fetal ultrasound is characteristics of Down syndrome. A nuptial translucency is a specific ultrasound screening measures baby's nasal bone as well as the fluid at the back of the baby's neck. A high volume of fluid can be a sign of a problem. The best method for early diagnosis of cervical cancer is pap smear, colposcopy and biopsy, health education, or HPV vaccine, that is for human papilloma virus vaccine. The correct answer: the best method for early diagnosis of cervical cancer is pap smear. Pap smear involves collecting cells from the cervix, the lower narrow end of uterus at the top of the vagina. Non-stress test is said to be normal if there are 2 or more FHR acceleration during 20-minute period, 2 or more FHR accelerations in a 40-minute period, no deceleration during a 40-minute observation, or no acceleration during a 40-minute observation. The correct answer: non-stress test is said to be normal if there are 2 or more FHR acceleration during 20-minute period. When is folic acid started in antenatal period to prevent congenital disorder in an infant? Before conception, during the 3rd trimester, during the 2nd trimester, or during the 1st trimester? The correct answer: folic acid started in antenatal period to prevent congenital disorder in an infant is before conception. Folic acid helps in the formation of the neural tube, so it prevents the defect of the neural tubes. Dusky hue of the vestibule and anterior vaginal wall visible at about 8th week of pregnancy is called as Goodell sign, Hagar sign, Chadwick sign, or sign. The correct answer: dusky hue of the vestibule and anterior vaginal wall visible at about 8th week of pregnancy is called as Chadwick sign. Which organ is the primary site of hematopoiesis in the fetus before mid-pregnancy? Lung, liver, bone, or spleen? The correct answer: organ which is the primary site of hematopoiesis in the fetus before mid-pregnancy is liver. Hematopoiesis is the formation of blood components or blood cellular components. Untwisting of the neck sustained during internal rotation is called as crowning, flexion, restitution, or torsion. The correct answer: untwisting of the neck sustained during internal rotation is called as restitution. Nurse is describing the process of fetal circulation to a client during a prenatal. The nurse accurately tells the client that fetal circulation consists of arteries carrying oxygenated blood to the fetus, veins carrying deoxygenated blood to the fetus, two umbilical arteries and one umbilical vein, two umbilical veins and one umbilical artery. The correct answer: the fetal circulation consists of two umbilical arteries and one umbilical vein. Linear burrowing of a mite at finger webs, wrist, elbow, ankles and penis seen in case of impetigo, psoriasis, scabies or herpes zoster. The correct answer: linear burrowing of a mite at finger webs, wrist, elbow, ankles and penis in seen case of impetigo. A pregnant client tells a nurse that she found some clear fluid during urination. The nurse immediately assesses the perineum and finds the umbilical cord coming out. The priority nursing action is shift to the emergency room, recording and reporting in nursing notes, start oxygen therapy, or place the client in the Trendelenburg position. The correct answer: if the umbilical cord is coming out, the priority nursing action is to place the client in the Trendelenburg position. Trendelenburg position involves the patient being placed with their head down and feet elevated. Which of the following is not a portable sign of pregnancy? Vaginal discharge, fetal heart rate detected by a non-electric device answer, Chadwick's sign, or uterine contraction. The correct answer: the following which is not a portable sign of pregnancy is fetal heart rate detected by a non-electric device answer. Which of the following should be informed to the pregnant client with genital herpes to protect the fetus? Total abstinence is necessary during pregnancy. Caesarean section will be needed in the case of vaginal lesions. Daily intake of acyclovir or 4-hourly sitz bath. The correct answer: the pregnant client with genital herpes is to protect the fetus by caesarean section will be needed in the case of vaginal lesions. All of the following are characteristics of false labor except no progress of contraction, relief by activity, irregular contractions or dilation and effacement of the cervix. The correct answer: the following are characteristics of false labor except dilation and effacement of the cervix. Perinatal death includes death during 37th week of gestation to 14 days after birth, 0 to 1 month of age, 0 to 28 days of age, or 28th week of gestation to 7 days after birth. The correct answer: perinatal death includes death during 28th week of gestation to 7 days after. A nurse teaches a pregnant client to perform Kegel exercise. Which statement by the client indicates an understanding to the purpose of these types of exercise? The exercise will prevent edema. The exercise will help strengthen the pelvic floor in preparation for delivery. The exercise will help reduce uterine contraction, or the exercise will help prevent urinary tenderness. The correct answer: The purpose of these type of exercise are: the exercise will help strengthen the pelvic floor in preparation for delivery. Kegel exercise, also known as pelvic floor exercise, involves repeatedly contracting and relaxing the muscles that form part of the pelvic floor. In a lecture on sexual functioning, a nurse will include the fact that ovulation occurs when the endometrial wall is sloughed off, blood level of LH is too high, oxytocin level is too high, or progesterone level is high. The correct answer: ovulation occurs when the blood level of LH is too high. Incision made into the perineum to enlarge the vaginal outlet and facilitate delivery is called vaginoplasty, vagotomy, episiotomy, or peniotomy. The correct answer: incision made into the perineum to enlarge the vaginal outlet and facilitate delivery is called episiotomy. Coombs test is performed to predict which complication in a fetus: physiologic hyperbilirubinemia, metabolic disorder, acute hemolytic disease, or genetic thalassemia. The correct answer: Coombs test is performed to predict complication of fetus, which is acute hemolytic disease. Coombs test is also known as antiglobulin test. Is either of two blood tests used in immunohematology. Descent of testes occurs before birth, 16 weeks, at 24 weeks, or after 7 months. The correct answer: descent of the testes occurs before birth. Which statement by the client indicates an understanding of the preventive measures of genital tract infection? I can touch anytime I want. I should avoid the use of condoms. I can wear my tight fitting jeans. I should wear underwear with a cotton panel liner. The correct answer: the statement by the client indicates an understanding of the preventive measures of genital tract infection is: I should wear underwear with a cotton panel liner. Treatment of hot flushes is administration of HPL, PAPPA, estrogen, or progesterone. Correct answer: treatment of hot flushes is the administration of estrogen. Hot flushes is the sudden feeling of warmth in the upper body, which is usually most intense over the face, neck, and chest. In a 28 days menstrual cycle, ovulation occurs in the following days: 21 days, 14 days, 18 days, or 7 days. The correct answer: in a 28 days menstrual cycle, ovulation occurs at 14th day. Dysmenorrhea is a excessive menstrual bleeding, irregular acyclic bleeding, painful menstruation, or cyclic repeat every 35 days. The correct answer: dysmenorrhea is a painful menstruation. Thank you everyone. Please don't forget to like and subscribe our channel.